Hello, my name is Kodalika Rani. I am an oncology nurse working with cancer patients. We do PICC line insertion for patients at our hospital. Here in this video, we'll be talking about how to take care for your PICC line. Start about is what a PICC line is. A PICC line is a peripherally inserted central catheter. So in this line, what we do is we insert a line which is placed in the upper part of the arm, and then with the help of local anesthesia, in order to reduce the pain, local anesthesia is given. So the main reasons that we do a PICC line is because there is a prolonged or lengthy treatment or chemotherapy. Secondly is because there is a difficulty in peripheral cannulation. Then we will talk about the maintenance of this line after the insertion. After insertion, we do need the help of the patient in order to maintain the line. So there are things and that needs to be done to maintain this PICC line. The first thing is, in the first 24 hours after the PICC line insertion, the patient has to go for a dressing after 24 hours, and then thereafter once a week. Secondly is flushing. Flushing needs to be done every time when the line is used. If not in use, then once a week. Thirdly, if the patient has to observe from time to time for infection. These are the few signs of infection. One is pain, swelling, redness, warmth, and pus formation around the insertion site. Fourth is, we always suggest a patient to continue with the sponge ball, or what we call it as smiley ball exercise on the arm which is of the insertion site. Then fifth is, we always suggest the patient to wear loose clothes in order to avoid pulling off the line. Then we also advise them to keep the line dry as much as possible, especially when taking bath. Cover the line with a plastic and then tie the upper and bottom portion in order to avoid drainage of water into the line. Then most importantly is, we advise them not to take blood pressure on the insertion site. When PICC line is done, there are chances of leakage of the line, but this rarely occur. So but when this leakage occur, we advise them to come to the hospital as immediately as possible, inform the available doctors or nurses, and from there accordingly further management will be taken care of or given. The line is rarely removed, but it stays mostly till the chemotherapy treatment is over. We remove the line rarely, but most cases are due to infection. The line is infected or accidentally pulled out. Then there is blockage or absence of backflow or forward flow, and the tip or position of the tip of the line is not at its proper position. To come to this end of this video, I am pleased to say that we have completed 3,000 patients who comes for PICC line insertion, and we have got a positive feedback with all insertions. So I advise, if any of you have any problem with PICC line, with any peripheral cannulation, we do advise you to go and suggest the doctor for a peripheral PICC line, because it do help you in the long run.